Hello, everyone. This is Health Professional Radio, and I'm your host, Tabitha Moretto. Our guest today is Dr. Ian Griffiths, CEO of Wound Management Innovation Cooperative Research Center and the incoming CEO of Wounds Innovation. Today, we're going to talk about a special coalition of leading diabetes organizations who have joined together in an effort to end avoidable diabetes-related amputations. Without further ado, welcome to the show, Ian. It's so nice to have you here.
Hello. Thanks for having me.
So, Ian, please tell the audience more about yourself.
Well, a little about myself, but more about the organizations I represent. The Wound CRC, or Cooperative Research Center, is a research organization which is primarily federally funded, but brings together industry and research partners to achieve outcomes of national significance. And that's what we believe we've done here. There's two items I'd like to talk about. The first being Wound Innovations, which is really the culmination and research translation of 8 years of work in the Wound CRC into a vehicle which can has a multidisciplinary group of clinicians that can be applied through telehealth, direct patient engagement, education, training, credentialing to really bring the standard of wounds knowledge and the treatment of wounds knowledge to a much higher level on a national basis. That's where, as the Wound CRC comes to its natural conclusion, the end of its funding cycle, that's where many of the assets have been moved so that they can continue to do good things for the nation beyond the term of the CRC. But really, you've invited me here to talk about the Diabetic Foot Australia. That was one of the initiatives funded through the Wounds CRC, and it engaged with its partners. And our aim there was to increase the knowledge of the diabetic foot disease, to provide practical solutions that could be implemented through podiatrists and diabetes specialists, and also to measure the prevalence of diabetic foot problems and the health economics associated with poor management of those foot problems. And we've managed to do all that in a vehicle called Diabetic Foot Australia, which we're now happy is being transferred to the Australian Diabetes Society to continue the good work and also reach into a whole new branch of healthcare professionals, people who worry about diabetes, endocrinologists, people who focus on metabolic disease, as well as the people who work on the feet. Because although many people live with diabetes, it's often the foot problems that are the things that cause amputations and ultimately lead to morbidity.
Yes, this sounds very fascinating. So can you tell us, Ian, how prevalent is diabetic foot disease in Australia nowadays?
Okay, some basic stats: around 4,400 new cases reported each year, and they're the ones that are reported. There are many that go unreported, and that translates to around 350 hospitalizations every day due to a foot complication and about 13 amputations. So we reduced this to Canberra. The number of people with a foot complication identified at any one time is about the population of Canberra, about 400,000 or so. We could fill, if we could put every person who's hospitalized due to a foot complication into the hospital, that would fill one of the major teaching hospitals in Canberra. And then the Canberra Raiders, all 13 of them, would have a limb removed every day through diabetic foot complications. So it's really quite a silent epidemic.
Yes, it does sound like a silent epidemic indeed. So what can people do in order to prevent this from happening?
There are awareness and early intervention and prevention are many of the things our work is focused on. Giving the not only the podiatrist but the diabetologist tools that are easy to use, patient information that's easy to understand and follow, and an awareness of the journey. So we've developed a patient passport where the patient, it's a record that follows the patient, so any carer that engages in the future understands what's happened and how to manage that patient better. So very practical tools underpinned by quality research allow us to engage with patients, carers, and healthcare professionals on all levels to bring a more comprehensive understanding to the management of the diabetic foot problem.
That's very interesting. Now, if you don't mind, Ian, can I ask you a personal question?
Sure.
Why are you so passionate about helping people with diabetes?
That's a brush in every family of diabetes, and we all understand the complications that can bring to loved ones. I suppose a little bit of that, but also through my professional engagement, I meet patients and their families. I see people that this affects nearly every day of my life, and you can't help thinking that we've got to do better for these people. We have a wonderful healthcare system, but this particular indication has fallen through the gap. People don't understand how to manage and treat well enough. Of course, there's wonderful skilled clinicians out there, but they're not connected in a meaningful way that would allow this information to be more broadly disseminated. And these very practical steps can be taken to ensure that these patients either don't end up in some of the terrible states I see with one or more limbs amputated, or the progression of the disease is much reduced through practical implementation of simple things. So meeting these people, seeing their journey, and knowing that it could be better managed or avoided is something that's been a driving force in this whole journey.
Fantastic. Thank you so much for sharing that story with us.
My pleasure.
Dr. Ian, I would love to chat with you more, but we're running out of time. But before we go, what is your main takeaway message to all of our listeners out there?
I would say that if people have the onset of diabetes, their feet are very, very important. People who have diabetes, as it advances, lose the sensation in the feet. As they lose the sensation in the feet, they can hurt the skin and break the skin. Once the skin is broken, the onset of ulceration and disease is rapid. So black toes aren't acceptable. And if you can't feel your feet, that's also a bad sign, and you need to seek professional help and guidance with footwear to manage any problems that you have, so that you don't end up with one less leg.
That was a fantastic message. And before we go, can you tell us, for those who want to get in contact with you, how can they do that?
Several ways. Our new partnership with Australian Diabetes Society will have a portal to the Diabetic Foot Australia group, and through Wound Innovations, which is the legacy vehicle I talked about earlier. We also will continue to collaborate and work with the Australian Diabetes Society through DFA. So DFA has its own website, Wound Innovations and Australian Diabetes Society. If you go to any of those, you can get information on the Diabetic Foot Australia.
That's wonderful. Thank you so much, Ian, for coming on the show. It was fantastic having you.
My pleasure. Have a good day.
And that was Dr. Ian Griffiths. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moretto, and you're listening to Health Professional Radio.